Assalamu alaikum and welcome back to Medic Hour. We've been spending the first half hour of the before the break talking about angina and heart attacks, and we're about to talk about how to look after ourselves in relation to our hearts so that hopefully we don't end up with conditions like that. So then, Liz, what do I need to do in order to make sure that we reduce the risks of heart problems?
Well, prevention's always better than cure.
It is.
So,
and easier said than done.
Very definitely, I couldn't agree more. But I think there are a few points that are so important, we really do have to hammer them home. So could we have our first photograph of one of the most important things that is so relevant to heart problems? Now this is a really grim photograph. This is showing us the severe consequences of smoking. So smoking damages blood vessels, and this horrible photograph is showing the damage it can do to the circulation going to our feet. But I want people to be equally aware that smoking is really bad for our hearts.
Okay.
So anybody who is a smoker, I would ask them to seriously consider stopping smoking. I think we mentioned previously, we appreciate how difficult it is. There is a lot of help available for people who want to stop smoking. Often a good place to start is to go into your general practice, speak to the practice nurse. So many practice nurses have been highly trained to help people to stop smoking. So we've got all sorts, we've got chewing gum, we've got patches, we've got tablets. That's just one of the a few of the ways, just the support that goes with.
And these are on the NHS, aren't they?
Yeah, absolutely on the NHS. You can look on, if anybody wants to go on the computer and look, smoking cessation. There's lots of local branches. If you ask at your GP, sometimes you'll see signs in the library, all over the place. And if you go and have support, you stand a lot higher chance of stopping smoking. It is incredibly hard to stop smoking.
It is, and I think it's about that motivation as well. What motivates us to want to stop smoking? And obviously some of the things we're talking about, we're hoping are going to be motivators.
I mean, smoking is an addiction. I mean, my dad used to smoke, one of my brothers smokes, and they are very intelligent people, but unfortunately, once you start, it's very hard to stop. So you do need a lot of support and a lot of guidance.
And understanding about the fact that you can have, you know, you can be really positive sometimes. It's like with trying to lose weight and everything else. You have good days and you have bad days. It's about what you do when you're having a bad day and how do you pick yourself back up to get back on track.
So just to emphasise, smoking plays such an important role when it comes to heart problems.
Okay.
Let's go for the next picture, please, Aftab. And this will be no surprise to anybody, and this is something we all hate doing, and that's getting on the scales and seeing the truth. And unfortunately, being heavy is a huge strain when it comes to heart problems. I mean, if you imagine, here we go back, the heart's a pump, it's pumping the blood round our body. The bigger a body there is to pump the blood round, the harder it has to work. And that's the same for if we're struggling with pain in our knees, if we've got back pain, the heavier we are, the more difficult it is. So very important, think about weight. And we've talked a bit about food previously, but being overweight is again another strain on the heart.
So taking that seriously.
Yeah, and in fact, can we have our next picture? And this is a rather silly picture, but it just brings home when we're talking about thinking about food, thinking about fat, thinking about, your words again, portion control. I mean, there's nothing wrong in having a burger. There's nothing wrong in having some chips.
That looks like a triple burger.
I think when we're talking about portion control, I really am showing people that portion control does actually make a big difference.
Now, pictures like that are also making me think about our younger generation.
Good thinking.
Who don't think about heart health as much as perhaps us oldies do. So in terms of pictures like that reminding us, these are the burger joints on every corner in our communities. This is where we get the cheap fast food and the quick fix for when we're starving and can't be bothered cooking or we're tired and finished a quick, you know.
Well, it's a very sad fact that at very young ages we start to get cholesterol starting to narrow our blood vessels. So very, very important, even at a young age, to think about this.
So even school children?
Well, very sad fact, after the Vietnamese War, post-mortems were done on some of the American soldiers, and even the very young soldiers in their early 20s were shown to have signs that cholesterol was already starting to narrow their arteries. So right from the word go, we should be thinking about the food we eat. We're not saying never, we're just saying be sensible.
Yeah.
So yeah, I'm afraid it's a rather sad fact to be bringing up that, but just to encourage people to think positively about making changes in the diet.
Yeah, I guess because for many people it's a case of they start to think about heart health and other issues, including smoking and weight and all the rest of it, because something terrible's happened, either to somebody close to them or to themselves.
I mean, a lot of people imagine heart attacks happen to old people, but actually quite a vast number of people, young, under 75, under 60, under 50, can still have heart attacks. Yeah. So these are really sad. They touch everybody's lives. So we mustn't think it's just something that happens to old people.
And I think that's quite a poignant point as well, that they do touch other people's lives, just because if it doesn't happen to you but it happens to somebody that you love and care about, then that's devastating too. Yeah. And I can relate that directly to somebody that I'm very close to that's recently gone through something like this.
So anyway, let's be positive. Let's talk about what we can do to look after ourselves.
Brilliant.
And can we have our next photograph, please? This is something that people sort of know really, but they're perhaps not always as keen. Taking some exercise.
Ah, the dreaded exercise.
Well, no, I don't want us to think dreaded. I mean, look at those photos. Those people are actually enjoying themselves.
They do look like
they're
having
fun. That elderly lady in her wheelchair who's doing what can be called chair aerobics. She's got some weights in her hands. She could just as well have a jar of beans and a jar of jam in one hand, and she could be doing exercises because every bit counts. Look at those people at the swimming pool, perhaps having a race with their friend. You can do
the grandchildren.
Yes, you can do aquarobics. You don't even have to be able to swim. Walking through water is actually quite tiring and fantastic exercise. Those people on their bikes, cycling through the local parks, you know, you don't have to be climbing up mountains on your bikes. You can have a great time going on the quiet country roads. Be careful, wear a helmet, but you know, there's great things to do.
And then even just walking around the block.
Yeah, look, we've got a picture there, somebody wandering around the park. But also, could we go on to our next slide? Those pictures seem to be rather formally exercise, but if we could look at what's great fun and physical activity. So here we go, we've got somebody hopefully enjoying his gardening. Yeah. We've got somebody there cleaning their car. I know a lot of us aren't too keen at cleaning our car. We've got.
Are you talking about mine, Lisa?
No, I didn't say that. I said nothing. But cleaning your car, there we are, stretching and carrying the water, all good exercise. We've got, I don't know about you, if this rings a bell, getting your bucket out and your mop and cleaning the floor. Yep. We've got just walking up the stairs instead of using lifts. And look about that. Doesn't that lady look to be having a lovely time?
So yeah, dancing is certainly an activity that many people are involved in today.
Exactly. So I went to a Zumba class yesterday and had a fantastic time. I was completely useless, kept bumping into the lady next door to me, but it was great fun. Yeah. So any sort of exercise, and if you find something that you like, you're more likely to stick to it. And if you do it with a friend, you're more likely to do it. The day you can't be bothered, she says, come on, we're going, and vice versa.
Well, I had a question here about, you know, what if you're struggling to exercise? Because somebody that talked to me recently about this topic was saying that, you know, she lives with a chronic pain condition, so exercise is hard for her. Certainly the kind of things that we've been talking about there aren't easy.
I think every person has to find what they can do, what they're comfortable with and what they're happy with. Yeah. And they may start from a really not very, what might be considered difficult level. So it might be somebody walks to the end of their drive, to their gate, turns round and comes back again. Yes. And they do that a few times, and then it might be the next week they manage to go out of the gate and a little bit farther down the road. Yeah, to the lamp post or something. And it is just building up on it. You don't have to imagine from the word go. You have to be walking miles and miles. It can be you know, getting off the bus stop a little earlier. It's anything which you can manage.
I think we were talking last time about parking the car a bit further from the door to the supermarket and that little bit of extra walk. But it is about things that are practical and that you can achieve and then just building upon them.
And if you find something which you like, you're far more likely to stay with it than something which you don't enjoy and is like a penance.
Yeah.
So, and it might be just finding a friend that you really like and saying, let's go for it. Instead of sitting down and having a cup of tea and a chat, let's go for a walk and a chat.
Yeah.
So good just those sorts of simple things, really.
Yeah, I guess we can be as creative as our imagination takes us, really, don't we? And it's about the reality of what we can fit into our lives, but also, like you say, you've got to build up on it, not to assume that you're at the same phase of activity as other people that are already perhaps ahead of you on that.
I mean, you think of these people who run marathons. They didn't wake up one day and run 26 miles. They probably started with a bit of a gentle jog. They extended it. They did a bit more. They did a 5K. They moved on to a 10K. You know, these things don't happen overnight.
No, they don't.
So you don't have to set yourself an impossible task that you can't manage. Choose something you can manage.
I think that's a really good reminder. Thank you so much. That's really helpful to think about. We need to talk about blood pressure.
Yeah, you're absolutely right, because blood pressure is so important when we're talking about hearts. So the question is, why? How does blood pressure tie in with your heart? Well, here we go back again. We're going to our central heating system. We're going back to the boiler and the pump. So we've got our heart, which is pumping the blood through our bodies. So if we make the pipes narrower or we cause a bit of a blockage, then the heart has to work harder. In other words, if the pressure in the system increases, that pump has to work harder.
Okay.
And you can imagine we're putting more of a strain on it if it's having to work harder to push the blood through our bodies.
Okay.
So having your blood pressure measured is very important, because if the blood pressure's at the right level, our heart isn't overstrained and it's going to work longer, it's going to work better.
So you hear of high blood pressure, and you're talking about high blood pressure, and there's also low blood pressure. So is that harmful too?
Right. High blood pressure is particularly harmful.
Okay.
And depending on the person, etc., most likely is going to need some sort of treatment, and I'm thinking about tablets, medicines, to help lower the blood pressure. Low blood pressure is quite unusual. More people have high blood pressure than low blood pressure. If your blood pressure is too low, it can make you feel lightheaded or dizzy.
Okay.
So, for instance, particularly older people may find sometimes when they stand up from getting out of bed or in their chair, they may feel lightheaded, and that might be because they have a low blood pressure when they stand up.
So what should you do about that then?
Well, if that's a problem, particularly noticing it when you stand up, you're feeling dizzy, or anybody feeling a bit dizzy or lightheaded, again, go and have your blood pressure checked. And that will 9 times out of 10 mean going to see your GP, going to see the practice nurse, having it checked there.
So how often should you have your blood pressure checked?
Well, for somebody over 40, having it checked, and if your blood pressure's at a certain level, then you probably only need to have it checked every 2 or 3 years.
Oh, okay.
However, if you're at a borderline level, you may need to have it checked more regularly. I think it can be a bit scary going to have your blood pressure checked. You go to the doctors and you're thinking, oh gosh, what if they find it's high? Yeah. Oh my goodness, and you start getting a bit nervous, and it puts your blood pressure up. Yeah. So very often you may find the first time that you go, the practice nurse may be saying, yeah, you're just a bit on the borderline, will you come back next week? And the next week it's not quite as scary because you sort of know what's going to happen, and you've not rushed there, run off the bus, you're 10 minutes late, you're in a bit of a panic anyway. So maybe you just get there early, you sit down for five minutes. Very often, if your blood pressure is borderline, because we recognise just going to the doctors to have it measured can be scary, a lot of GP practices now will have a blood pressure machine which basically they can put on and send you home, and
Yes.
it will make a recording of your blood pressure over 24 hours or more. Because very often when you get home, you're sitting in your armchair dozing because there's something boring on the telly, your blood pressure's absolutely fabulous. But the stress and the worry that was associated going to the doctors was enough to put it up. So then when you go back and the doctor, the nurse, has a look at the readings from that portable blood pressure machine, they can make a very definite decision if your blood pressure is higher than it should be, and if you really do need to be taking some sort of medication.
Okay. Some of the things you were saying there made me think about stress, because you're talking about that rushing to the doctor, being busy and all the other things that can make your blood pressure go high. So are we talking about stress playing a part in increasing your blood pressure?
I think if you are very worried or stressed, it can put your blood pressure up.
Some people hold a lot of emotion inside, don't they? Is that going to do that?
Well, I think we're all different, and for some people the stress and anxiety can be a short-lived thing.
Okay.
So you're going for a job interview and you're really quite stressed for that hour or so before. You're stressed while you're in the interview. The minute you walk out of the interview, great, that's gone. So stress depends on the person, but there's no doubt stress can make a difference onto your blood pressure. So again, going and having it checked. You mentioned earlier about the role of medication and tablets in general, and we were going to talk perhaps a little bit, and now seems a good time, about the people who've had a heart attack, or in fact who've got angina. Do they need tablets? So there are definitely certain tablets which after a heart attack will need to be taken by a lot of people. And you mentioned two of the very important ones. You mentioned a tablet called a beta blocker, and you mentioned a tablet called an ACE inhibitor. So if we home in, for instance, on the blood pressure tablet, on the beta blocker, beta blockers are tablets which generally slow the heart down and at the same time will reduce the blood pressure. So if we reduce blood pressure, then the heart doesn't have to work as hard, so it has a bit of a rest, really.
So are you saying that high blood pressure is always linked to heart problems, or does high blood pressure do other things as well?
I think very often high blood pressure is linked to heart problems. So reducing blood pressure can give the heart an easier time.
So that's why it's important.
Beta blockers taken after a heart attack are not just to reduce the blood pressure, they have like a protective effect on the heart. Another tablet you mentioned, ACE inhibitors.
What's that?
Those are tablets which usually end in pril, so we can have ramipril,
I've heard of that
enalapril, so those sorts of tablets. And those have again a protective effect on the heart after a heart attack, and they will also reduce blood pressure.
So how are they protecting them?
How are they? By reducing blood pressure.
Oh, just to do with blood pressure being reduced. Okay, I wasn't quite clear on that.
One of the most straightforward ways to understand it.
I understand. All right.
But again, do you remember we talked about cholesterol? And one thing we haven't mentioned yet is the use of tablets when it comes to lowering the level of cholesterol.
Are you going to talk to me about statins?
I am going to talk to you about statins.
Because there's a lot of controversy about statins now.
Well, do you know of any tablet that for some people doesn't cause a side effect? Because
we're certainly told they all do. They all can, don't we?
Well, paracetamol for some people doesn't actually agree. So, I mean, I can take penicillin with no problems, but some people will have dreadful problems. So all tablets have the good side and they can have their bad sides. So there's no doubt that statins are not without side effects. And the usual side effects people talk about are uncomfortable aches in the big muscles, so the muscles of their legs, sometimes the muscles of their arms. So for some people that can be a problem. We do have different sorts of statins. Some people may have heard of simvastatin or atorvastatin or pravastatin. We've got quite a few different ones.
So are those brand names or just different
no,
types
those
of statins?
are the actual names of the tablet.
Okay.
So in fact, if some people can't manage simvastatin, they may manage pravastatin.
So it's worth
if some
telling your
people
doctor
can't manage 40 milligrams of simvastatin, they may manage 20 milligrams. So we've got lots of different ways we can actually help. But do you remember how those pictures of the cholesterol in the blood vessels blocking?
Yeah.
So reducing cholesterol and stopping the cholesterol from floating off and blocking arteries is so important, and that's what the statin tablets are there for.
Okay.
Not to mention if we can think about our diet as well. But only 20% of the cholesterol that we measure in our blood has come from what we eat. Our bodies are able to make our own cholesterol.
Oh, okay.
So if you were on a desert island, this is a bit silly, Rabina, but if you were stranded on a desert island and all you could eat was lettuce leaf and carrots, you could still have a high level of cholesterol because your body can convert other things into cholesterol.
Okay.
So it's not just a question of reducing the dietary content which has got cholesterol in it.
But it sounds to me like the benefits of the statins are that, like your diet, if you can tweak it to match your needs and to reduce any side effects, that is something that can give you a lot of good outcomes rather than just the side effects. Okay, so it sounds to me then it's something that anybody going through any aches and pains or side effects should be talking to the doctors to review
find
it.
out. Yes, that's right.
Okay, all right.
And one other thing, we must talk about aspirin. Aspirin for people who've had a heart attack is also an essential tablet. Do you remember we showed the picture where the artery was partly blocked with the cholesterol, but then the heart attack one had got the blood had clotted. And so what the aspirin does is it affects how the blood clots, so it's less likely to clot and block the artery. So taking an aspirin is very important. Or there are other tablets, perhaps people have heard of clopidogrel or clopidogrel. We all say it in different ways.
No.
So there are different tablets which are also very, very helpful in preventing problems after a heart attack. And there's quite a few other tablets, but I think what we've tried to do now is to talk about the most common ones so that people perhaps will remember some of the tablets and identify with the tablets that they're taking or somebody in the family's taking.
I just want to ask about the aspirin a little bit more, because we're also talking about people who haven't had, thankfully, these outcomes. They've not had a heart attack, they've not had angina, but they're worrying about it. Is that something that your everyday person should think about, taking an aspirin, even though they've got no history, but they've got weight issues or they're smokers?
Well, that's quite an interesting question, and it's not quite a straightforward question because it does depend on the person.
Okay.
But I think there is no doubt we call secondary prevention. If somebody's already had a heart attack or a stroke, we don't want them to have another one, so an aspirin is essential. But for somebody who's never had a problem with a heart attack or a stroke, taking an aspirin depends very much on the person, and probably not for everybody is indicated.
Okay, so maybe best to take advice then.
Some people are taking aspirins, interestingly enough, for totally other reasons.
Okay.
There has been some research that showed it reduces the risk of bowel cancer.
Right.
So for somebody who's got a family history or other reasons, they may be advised to take aspirin.
Okay.
We just touched on strokes.
I'm afraid we're running out of time, so it's a topic for another day, I think.
Definitely.
I think, thank you so much. There's so much we've covered, and yet so much more we could cover, Liz, and it's really highlighted to me the importance of continuing the conversation on other areas of this. I need your top tips for the day.
We say the same things every time, don't we? We're going back again to diet, exercise. If you're over 40, go and have your blood pressure checked.
Yeah.
That's good enough to start with, I think.
I think
enough to think about.
Lots to think about. Thank you so much. Okay, so that brings us to the end of the show. Jazakallah khairan for watching. I hope you found it useful, and I hope you'll continue to look out for Medicower in the future too. Assalamu alaikum wa rahmatullahi wa barakatuh.